Bone scanning is a nuclear medicine test in which a small amount of a radioactive substance, known as a tracer, is injected into the body and detects cancer by appearing in overly large or light amounts in certain areas of the body.
Bone scanning, aka skeletal scintigraphy, helps to diagnose and assess an abundance of bone diseases and conditions throughout the skeleton of any living thing. Due to the fact that bone scanning is very precise, it can detect diseases in their earliest stages, such as metastatic cancer. Doctors are able to locate these abnormalities and diseases through the use of identifying hotspots and cold spots. So, what are hot and cold spots? Well, hotspots are defined as areas where there is a build-up of radio traces. Hotspots can be easily identified on the scans as these traces have a distinctive bright glow to them. Therefore, areas which appear abnormally bright are classified as hotspots. Hotspots allow doctors to make a diagnosis and may mean the patient either has a fractured bone which is healing, bone cancer, a bone infection, arthritis, or a disease of abnormal bone metabolism, such as Paget's disease. On the other hand, cold spots are areas which collect little to no traces and appear darker on the scans. Cold spots can show certain types of cancer or a lack of blood supply to the bone.
Bone scans use a radio tracer or a radioactive substance to detect abnormalities within a person's bones. Technetium-99m is a widely used radio tracer isotope in nuclear medicine. It is ideal for bone scanning for a variety of reasons. It solely emits gamma rays, which are convenient for detection as they can easily penetrate the human body without being absorbed. Another advantage is that gamma is a single energy produced. It isn't accompanied by alpha or beta emissions, which allows for more precise imaging. Its half-life is approximately 6 hours, which is very long. This allows a tracer to be properly dispersed throughout the body and to perform the scan. This is extremely long for a decay within a substance. The very long excited state leading to the decay is called a metastable state, as the substance is releasing gamma rays for an extended amount of time without the substance decaying. The radio tracer travels to damaged sites of the skeleton through the circulatory system. The tracer travels until it finds hydroxyapatite. It is a crucial aspect of bone regeneration. It binds to the substance, allowing the gamma camera to detect the exact site that is damaged.
Bone scanning provides in-depth detail on both the function and the anatomic structure of the body, which is unattainable using other imaging procedures such as X-rays. For many diseases, bone scanning provides the most useful information needed to make a diagnosis or to determine if a treatment is required. The effect of this treatment on the bone abnormality can then be monitored via a bone scan to track its progress. Not only is bone scanning less expensive than exploratory surgery, but it also displays more precise information. Another benefit of bone scanning is that it helps physicians evaluate the condition of your bones and helps detect the fractures and other abnormalities that may be missed in an X-ray exam. Bone scanning can provide early detection of primary cancer or cancer that has spread to the bones from other parts of the body. Finally, bone scans can detect osteomyelitis, which is an infection of the bone or bone marrow. A limitation of bone scanning is that although it can detect some forms of cancer, it cannot detect them all. Another limitation is that abnormal findings on a bone scan can require additional tests like CTs, MRIs, blood tests, or a biopsy to help distinguish between normal and abnormal bone. Bone scans are very time consuming, which contributes to another limitation, as it can take several hours or days for the radio tracer to accumulate within the targeted location. Imaging may take up to several hours as well. However, with the development of bone scanning, newer equipment is being introduced that can substantially shorten the procedure time. The resolution of the structure of the body with bone scans may not be as high as other imaging techniques such as CTs or MRIs. Finally, there exists a limitation on who can receive a bone scan. This is based upon the fact that the scan may be unsafe for pregnant or breastfeeding women. There is a risk of injury to the fetus and of contaminating the breast milk.